welcome Helmy and AmirAli. I will give them a moment just to quickly introduce themselves, and then I want to talk about what it means to have health equity and to reduce inequalities by using innovation. I was really struck by the head of the UN Food Program, who came up yesterday and said, you know, we don't need more money. We have $9 billion, and we continue to get more. What we need more of is innovation. And so if anyone has an idea on how we can do things better, talk to me about that. So in that vein, let's start with AmirAli. Tell us about your background and about Guardant Health. Oh, are we missing a microphone? There should be one on your seat.
Oh, here we go.
Okay. Because both of you have kind of unconventional background for what I would call a healthcare company.
Yeah, great to be here. I'm co-founder, co-CEO of Guardant Health. Background in engineering, and then with the mission of bringing a bunch of engineering concept to healthcare with the ultimate mission of trying to bring social values, bringing brighter days for the community, especially for patients. Dedicated 2 decades of my career, specifically around building diagnostic tests and solutions for cancer patients across continuum of care. What we've done at Guardant actually was continued progress of a field which has been making huge advancements during last couple decades. Many researchers in academia and research centers actually have spent their life working on some tumor biomarkers which exist in circulation of patients, exist in the bloodstream of cancer patients, with the ultimate vision that if you can analyze those kind of biomarkers, not only you can maybe help patients with advanced cancer to bring more precision diagnostics to them, to treat them more wisely, but also look at cancer survivors to see if their cancers are coming back or not. Having that information may actually have a very important implication of the management of that patient to bring better outcomes. And ultimately, the vision a bunch of those pioneering scientists was to see if these blood tests can detect cancers at early stages, screen for early signs of disease. And we are very happy that as community, the work that we've done with a bunch of other partners and other companies in this field, those futures, that vision is here and now. With a blood test, you can detect cancers at early stages that we are excited to talk about more.
That's wonderful. So, you know, we're at UN. We can't do this without statistics, right? So I was just looking up some statistics that, you know, about 7% of the world ends up with cancer. That's a huge statistic if you look at the world population. And even in the US, there were 20 million people who are diagnosed with cancer and 10 million who die from it. So for a country that is very advanced, we're still suffering quite a bit. So the way to cure cancer has to be diagnostic, is where we start. But let me now switch gears and go to the other side. So I love how this conversation is very cleanly divided. Cancer diagnostic for early detection and management of cancer if you have it. So many of us have loved ones who are living with cancer or have been diagnosed with cancer. So Helmy, tell us about that part of your business and your company as to what it does for those patients.
Yeah, so this is actually the first test we developed as a company. This field is called liquid biopsy. It's the idea of being able to get tumor information that's embedded inside the tissue, but from a simple tube of blood. And so we developed the first liquid biopsy in 2014. And you know, let me paint a picture for you of what cancer looked like, what cancer diagnostics look like for an advanced cancer patient before 2014. The average lung cancer patient needs to get a biopsy to be able to understand essentially what are the markers that are driving the tumor, what are the genomics of the tumor, so that they can match that patient with the best possible drugs. Unfortunately, in the US, the average lung biopsy costs $14,000, has a 19% complication rate, and a 1% to 2% mortality rate. And the statistics are similar in many other countries. And so after our test, we could get all of that same information through a simple blood test. So it really was a big, big breakthrough in terms of being able to remove the impediments in terms of access to the best possible care, essentially through a tube of blood, which anyone can administer. I'll give you an example. So we launched the test in 2014, and I think something like the 15th test we ran was a woman, a 48-year-old woman. She got diagnosed with pancreatic cancer. This was in the San Francisco Bay Area. And she was given only 2 months to live. And she didn't want to accept that. She had 2 young kids, and so she went to another institution. Basically, worked with a doctor that was working with us as well. And he said, there's this new blood test out there. Let's try that. Let's give it a shot. They ran the test, and we basically found out that there were markers there that were not consistent with pancreatic cancer. They were actually consistent with ovarian cancer. Ran a few more tests, realized it was really ovarian cancer, put her on a drug that has been available for 30 years, that was just sitting on a shelf, and she had a complete response. And this was really what we call our field of dreams moment. They say if you build it, will they come? And sure enough, they came. And now this has really revolutionized the field. We estimate something like 25% of U.S. cancer patients are getting this exact test today. But what was really shocking to me, I worked in the field of genomics, Human Genome Project, all those kinds of things, and was always thinking about how can we do better, how can we develop breakthrough drugs, breakthrough technologies. But the biggest, I think, possible improvement we can have as a society, both in the US and many other countries, is about closing the gap between essentially guideline recommended care at the highest levels and what's actually being done at the practice level. That gap by itself would improve outcomes dramatically. It would reduce costs, and that's what we're seeing with this technology today.
Thank you. It's funny, it's a cancer diagnostic company panel, but I'm just so happy moderating it because of all of the amazing innovations that I'm hearing about. Another thing that I find fascinating, I'm someone outside of the healthcare industry, is that, what are your PhDs in, both of you?
Electrical engineering.
And yours?
Same, yeah.
So, I love that we're now in a multidisciplinary era for healthcare, which means engineers don't give up. They figure stuff out. It's not a binary game for them so much. I would like to ask you about a very big moment that Guardant Health had recently, and then I want to talk more generally about your views on the world. Is that, you got this FDA approval, you get to ring the bell on New York Stock Exchange, what was it, 2-3 weeks ago? Tell us about that FDA approval and what it means for the world and for people who have to routinely, regardless of cancer, have to get these screenings for colorectal cancer. No one likes a colonoscopy.
Still, actually, we recommend colonoscopy if you have access to. Maybe I step back a little bit and talk about really what's going on with the field of cancer right now at global level. When we are looking at the rising healthcare costs associated with disease management, and specifically in this field of oncology, and how much less we are investing in prevention. And we know at the health system level, in fact, one of the effective ways to manage the costs and bring health equity to patients is by making sure that we can do preventions and protect their wellness. And we have some successful examples: polio immunization, tobacco cessation, and so forth. Mammogram for breast cancer screening. There are some kind of great examples that we have that once we embrace those kind of prevention and protection of wellness, we can bring equity, and in fact, we can manage the healthcare costs in a much more reasonable way. So in the field of oncology, a lot of actually spend is about managing the sickness, managing the symptoms, treatment. It's very important to make sure we give precise treatment, right treatment to cancer patients. But we can bring much better days in an equitable way if we can avoid those kind of cancer cases. So now connecting it to a blood test, now with this FDA approval that we are very excited, we got it a few weeks ago, with just a simple blood test, patient can screen to see if they have colon cancer or not. This is for average risk patient who are healthy, and The big healthcare problem with colorectal cancer screening is at global level, the screening is not getting done very effectively. In many countries, colonoscopy, although it works, is not really an option based on to do it especially in an equitable way. The infrastructures are not there, systems cannot support it. And other modalities like stool-based testing, they are effective, but the problem is many patients have hesitation to go through those kind of testing. So what we end up with in different countries, even if they have access to those screening technologies, sometimes less than 20% of the population get the screening done. Now just imagine a routine blood test that can detect these colon cancers at very early stage when they are really treatable and curable. We are very excited about it, and I think through globalization of this kind of innovation, through public-private partnership, we can really bring much brighter days for the patients.
Thank you. So now I'm going to do what I'm not supposed to do, but I'll do it anyway, which is you're public company CEOs and you cannot make forward-looking statements and all that stuff. But can we, for a minute, just talk about it and just say, what do you have in store as these innovators, as these scientists, and these visionaries that the two of you are? What do you have in store? What is your dream for Guardant Health? What more do you want to do? Just so we know what kind of people you are and what are you doing here.
Yeah, so we're in it basically to give people more time. We've both had personal issues, family situations like many of you I'm sure have had, where the healthcare system has been very frustrating. Even today in the United States, 40% of our reports go out on fax machine. Healthcare is like the only industry that still uses pagers. So clearly, the natural laws of technology, like diffusion, don't really work in healthcare. There's a wall there that essentially, where the incumbents that are there are sort of preventing some of this stuff. And some of it has to do with the conservative nature of healthcare, by its very definition. And we come from the technology sort of world where we're all holding cell phones. We run our lives on them, and we've seen that deflationary force of technology that has really spurred a renaissance of technological innovation, productivity, and so on in so many countries. We can think of technology, leapfrogging in many countries that didn't have access to landlines. Cell phones essentially completely rebooted, a lot of those economies and supercharged them. And we believe the same thing can happen in healthcare. I talked about removing the need for a surgical biopsy with a blood test. The beauty of new technologies and innovation is that you can bypass the current biased sort of distribution systems that are there, the current walls that prevent health equity for all of the population. And so imagine that blood test today screens for colorectal cancer, tomorrow screens for 20, 30, 40, 50 different types of cancer, and then in a few years after that screens for 1,000 different diseases. And it's the same cost. Suddenly, you have the deflationary power of technology integration added to healthcare, and every country in the world, can adopt this in a way that absolutely makes sense from a health economic point of view. You're actually going to be saving money, not just like upfront, but essentially for the lifetime of the citizenry of those countries. And we're doing this in baby steps in multiple countries through, we embrace SDG 17 in terms of public-private partnerships. We're doing that in the UK, in Spain, in Italy now, we just announced, and many other countries. And we believe this is just the beginning.
Okay, now that I'm done coughing. This is for you, AmirAli. My question is more about look, you guys are doing amazing work for humanity and for all of us, right? So maybe this is the time I give you a wish list of if, let's say, you had a wish list of what would you like to see changed in terms of regulatory hurdles, in terms of your collaboration with the United Nations and other organizations like that. What is it that we can do, or people in the room can do? There are people here from World Health Organization, from UNDP. There are all kinds of organizations here. Is there a way that there can be, that we can support you in your good work? And what would you like to see in the world?
Yeah, I think the field of medical innovation and this kind of top-notch innovative technologies has been progressing so fast that I think we need to revisit a bunch of initiatives, policies that we have in our healthcare systems in different countries. So the rate of innovation has sped up significantly. The landscape is very different than 20 years ago, even 10 years ago. So I think I would invite all the decision makers and stakeholders to see how they can really benefit from these innovative technologies at scale within their constituent people. I give you some example that maybe would inspire some thinking by stakeholders. It's in very early days, but we are talking with some government about some pilot programs for nationwide cancer screening. At this time, just for the colon cancer indication that I talked about earlier, but soon, potentially it would be for multiple cancers, as Helmy mentioned. Maybe eventually it would become even multiple disease. The science is there. But those conversations are really empowered by deep commitment on public-private partnership. When you look at this kind of innovation, really we can have equitable access for all patients. It's a simple blood test. We can empower communities to bring these innovative technologies to the beneficiaries. For instance, in our pivotal clinical study that we've done, during the COVID, 40,000 patient study, the way that actually we did that study during the peak of COVID was really going to the communities, to the churches, to the community service centers, and enrolling patient, getting the blood draw from the patient in those kind of setting. Now just imagine if within your country, within your system, you can activate the community and bring these kind of innovative blood draws to the beneficiaries. I cannot emphasize more the role and the power of public-private partnerships to really bring much brighter days for the patients. Bright futures are just around the corner.
Thank you. I hope so too. So speaking of, knowing the power of knowledge, right? If you don't know a problem exists, how do you solve it? So many times we also have a feeling that, we don't want to know because then we're going to have to fix it. So maybe this is the way that we can, force policymakers and our communities and, our companies and insurance companies, force them to do things that they don't actually want to, they can live in denial of. So Helmy, tell us about what do you see about the future of cancer? Usually ask people, what do you see in your future, but what do you see in the future of cancer and the future of Guardant Health? And also about the competition in your space, all the other companies that are working on something like this. How can you be more collaborative and how can you also be helpful in the competition?
Yeah, that's one of the challenges that just the diagnostics industry has is, if you have a life-saving drug or a drug that can potentially save someone, or improve a health condition, it's very hard to deny a person access to that drug because that is the sort of intervention that could potentially improve outcomes. A test that may lead to that or information that may lead to that is one step removed. And so it's often very challenging to get payers, insurance companies, even governments to pay for that because they feel like, well, it's something I can avoid for now. It's better not to know. I don't have to pay for it. And it's not clear exactly how much that intervention, that test or that information will actually improve outcomes given all the successive steps that are there. And so that has been one of the challenges in the sort of diagnostics industry across the world is that we're not valuing the power of data information as much as it's actually worth. And that's where we've done a lot of work at the governmental level in terms of essentially changing policy. We've now passed with the American Cancer Society something like I think maybe 17 different state bills that have fortunately passed unanimously in many of those legislators to essentially force private payers to essentially pay for these diagnostic tests because they actually do improve costs. They're health economically advantageous. But unfortunately, we have to twist some arms. And we've worked with other diagnostic companies as well. But we're still in the nascent level. We're not as savvy as our pharmaceutical counterparts and some of the other sort of players in the healthcare industry. We've done this in other countries as well. And that's where we've seen, I would say, outside of the US, I think it's been much more productive in terms of working with a lot of these systems where the single payer system, it's more of a value-based sort of approach, thinking about the lifetime cost of the population there. I'll give you maybe one example. We recently had a really wonderful, I think, case study in England where we essentially built a lab at the Royal Marsden, which is one of the top cancer centers there. And essentially, they were so excited by the results. We were able to collaborate with the NHS there, with essentially the highest levels of government. And within, I think, 1 year, we did a pilot. We showed essentially we could reduce the wait time of a lung cancer patient from 120 days. So they were getting diagnosed with cancer. It took them 120 days to get on the right treatment, 4 months. The average life expectancy of a lung cancer patient is 11 months, just to put it in perspective. We were able to reduce that with our blood test because we bypassed the need for an interventional radiologist, a pathologist, basically an army of specialists, and we were able to reduce that to a couple of weeks. And so it was wildly successful. And I think the part that's even more exciting is the NHS embraced this. And so we went from basically testing no one a year ago to now approaching testing 50% of all lung cancer patients in England now. So that is really, I think, the power of collaboration at the deepest levels.
So, AmirAli, I want to end the conversation with you because we started with you. So I want to end the conversation again on a very positive, uplifting note. We've talked a lot about management of cancer with people who have cancer, and we've talked a little bit about the possibility of diagnosing more cancers. I don't know if it's okay to talk about it or not again. I should have compared notes earlier. But I know you're doing something about epigenetics as well and with the impact of that. Talk to us about some crazy engineering stuff that you're working on that could come up with great outcomes.
Yeah, sure. If you don't mind, I just make a comment about the prior topic. You mentioned about the value of partnership, value of collaboration and multi-stakeholder progress. Some of the fundamental problems we are going after are so hard that it's beyond one person, one company, or even sometimes one country. Like the progress that we made on these blood tests, liquid biopsy tests, we step on a lot of scientific advancements of some of the researchers who worked and dedicated their lifetime in this field of blood-based. Even on the private side, on the commercial side of it, the way that we can make progress is by committing to this value that we call it at Guardant, stronger together. As long as we are collaborative, as long as we are transparent about our progresses and so forth, that's the way the field is going to make progress to really bring brighter days for the patient. That at the end is ultimate goal of all. In terms of some of the scientific advancements, like I can easily get geeky and very excited about it, but just look at it this way. All the cells in the body have the same genome, almost. But what makes an eye cell, liver cell, brain cell, brain cell? It's some kind of chemical structural changes. We call them epigenomics. There are some, you can look at it as a software layer of the genome, and genome may be just a hardware layer. And those changes are very important in evolutionary biology. And those are some of the biomarkers that we are looking at to see if we can find early sign of disease in blood. Like you should not have a lot of colon tissue epigenomic signal in blood unless there is probably something wrong with your colon. So effectively, those are the biomarkers that we analyze to really see early signs of disease, early sign of immune system issues. And I could see in future, not based on our advancements, some other scientific advancements that are happening in the field, like you can detect early signs of Alzheimer, early signs of bunch of neurodegenerative diseases with the same blood test. We can really bring much better wellness to the patients, hopefully soon.
Well, thank you, doctors, for your service, and the engineers to our service to humanity. And thank you all for listening to us.